Hi, welcome to Dr. Updated. Recently, Usfda approved artificial tricuspid valve of heart. Product name, Edwards EVOQUE Tricuspid Valve Replacement System. What is it? The Edwards EVOQUE Tricuspid Valve Replacement System mainly includes an artificial tricuspid valve, called the EVOQUE valve, and a delivery catheter. The EVOQUE valve is made of cow tissue, attached to a self-expanding metal, nickel titanium, frame for support. It can be used to replace the tricuspid valve of the heart without open heart surgery. The tricuspid valve prevents backflow of blood into the right atrium, that is upper right chamber of the heart, from the right ventricle, that is lower right chamber of the heart. How does it work? The doctor compresses the EVOQUE valve and places it on the end of the delivery catheter. The doctor then inserts the catheter with the attached valve through the largest vein, femoral vein, in the groin area and pushes it through the blood vessels until it reaches the diseased tricuspid valve. The doctor then releases the valve from the catheter. The valve will expand to anchor within the patient's diseased valve. Finally, the doctor removes the delivery catheter from the body. Once the new valve is in place, it functions the same as the old valve, opening and closing like a door to force the blood to flow in the correct direction within the heart. When is it used? The EVOQUE valve is intended to treat patients with severely leaky tricuspid valve, tricuspid regurgitation, often caused by an enlarged heart, or damaged native valve flaps, called leaflets. What will it accomplish? The EVOQUE valve could reduce the amount of blood that moves in the wrong direction through the tricuspid valve. As a result, the patient may have improved quality of life, relief of symptoms such as tiredness or fatigue, improved ability to exercise. Kindly encourage us by subscribing our channel and liking this video. Thank you so much.